Welcome back to Angel Venus in tutorial. In this video, we are going to study about the subject is Fundamentals of Nursing for the first year, first semester, and we are going to study about the classification of hospital. So, we have studied the classification of hospital before up to the objectives. So, today we are going to study about the classification of hospital according to size. So, classification of the hospital according to the size. So, according to size, how we can classify the hospital? So, we can classify the hospital according to type, that is teaching hospital. For the symbol of hospital, I am giving like this, the symbol. Teaching hospital and district hospital, then taluk hospital, then PHC, or we can call it as primary health center. Or PHC. Okay, so this is the classification of hospital according to size. Here teaching hospital, the size, what it is mean that the number of bed in the hospital. Here in the teaching hospital, how many bed should be there means here up to 500 bed is needed. Okay, so 500 bed is needed. So that is number depends upon the number of students. So this depends upon number of students. The teaching hospital means the hospital which is conducting the practices for the students. So it should have the 500 bedded. Next one is a district hospital. District hospital means which with a 200 bed. So there 200 bed will be there. That the bed number should be increased upon the population. So that is population means number of patient admitted. According to that, have to increase the district hospital bed. So that is depends upon the population. Increase the bed. And next one is the taluk hospital. The taluk hospital means that is 50 bed. So taluk hospital that is 50 bed. That is depends same like that. Okay, depends upon the population they can rise. So there is more patient is comes means they can increase the bed. And last one is here is the primary health center, or else we can call it as a PHC. There is a 10 bed. It should have the 10 bed. Sorry, here will be the 6 bed. According to the patient, they can be increase the bed up to 10. So they can increase the bed up to 10. So that is the size of hospital. So according to the size, we have seen the teaching hospital, that is teaching hospital, that is 500 bed. So that means the students, those students who are studying or they have the posting there, they should have the 500 bed. And that district hospital 200, taluk hospital is 50 bed, and primary health center, that is a minimum 6 bed should be there. Okay, if the patient is goes there means they have to take the treatment there. If it is any fever or anything, it should that PHC should have the 6 bed, or else the number of patient will be increased. So they have to increase the bed up to 10. Okay, so this is about the size. Next we are going to the that is the classification of the management. So next is the classification of management. So according to management, how we can be classified? So according to management, we can classify. So there is this one, union government or Government of India, Then next one is the state government. And third one is the local bodies. And fourth one is the autonomous bodies. Autonomous bodies. And fifth one is the private hospital. And sixth one is the voluntary agency. Okay, so here, so this is according to the management. So first one is the union government or else government of India. So as you know, the government of India, so this is administered by this type of this union government or the government of India is administered by what? Administered by government of India. So that is easy. So government of India, they are controlling the hospital. So we can say that is government of India hospital, union government hospital. Example, all the hospital which is run by the, have you seen the railway hospital and the military defense. So that is depends on that is a control under the government. So here we can write the examples. Railway hospital and military hospital. Okay, so that is the government of India. The next one is the state government. The state government means that easy. So we can say same like that. That is the government is controlled by or it is administered by the state government. So as we have the government hospital in our this one, so state government hospital in our state. So that is administered by or it is controlled by the state government. State government. Government hospital. Right. State government hospital, irrigation police, that and all having the their state government hospital. Next one is the local bodies. So local bodies means nothing but that hospitals are administered by the local bodies. Like local bodies means so what is that? It's a municipal hospital. Okay. Then panchayat hospital, taluk. These and all will be coming under the this one. Taluk, panchayat, Jilla hospital. These and all will be coming under the local bodies. So what is the autonomous bodies? Autonomous bodies is nothing but the hospital established under the special act of the parliament or the state legislation founded by the central or state government. So I will say you the example of autonomous means that is the AIIMS. Have you heard about the AIIMS? Okay, AIIMS hospital. So that is that control it is under by the parliament and which give the control act of parliament and state legislation founded by the central government. So which is the control by the central government? Controlled by the central government. Controlled by the central government and which the act of parliament or the state government which is give the control by the central government, we can call it is the autonomous bodies. And next one is the private hospital. So as we know, so if you see anywhere you can see the private hospital, so which is under control of the private organization. So the hospital are owned by the private organization. Hospitals are owned by private organization. So can you tell me the example of that? So we can say, have you heard about the Manipal hospital which is there in Bangalore also? So example is Manipal hospital. Okay, so last is the voluntary hospital. Voluntary hospital means the hospital is administered by or voluntary operated by the trust or charitable society. So that is operated by operated by charitable society. Charitable society. So that is called autonomous. Okay, some of the example you can see that missionary hospital. So that is an example of that. So we have seen that according to the management, when you're writing for your exam, so you have to list out all the things first of all. Then only the examiner will give you the mark. Otherwise, they won't give. So you should write down, list down the these all the types. Okay, the management types, and you have to write about each one briefly. You have to write. So this is the classification of hospital under the management. So next we are going to study about the classification according to system. So what do you mean by system? System means is nothing but so different kind of hospital we can see in the our surroundings. Okay, you can see the allopathy hospital, Ayurvedic hospital, Unani, Homeo kind of hospital we can see. So according to that system we can classify the hospital. Okay, let's see one by one. So according to system. So according to system we can classify the hospitals. So first one is the, so we can write here, that is the allopathic hospital. So allopathic hospital means, so as we know that, so we are going the hospital, right? So that is a private or the hospital. So the those who are using the drugs, all the things. So all those things we can call it is a allopathic hospital. And next one is the Ayurvedic hospital. So Ayurvedic hospital. So Ayurvedic hospital means they are dealing with Ayurvedic items like all the natural things they are using. So that is called Ayurvedic hospital. And third one, homeopathic. Have you heard about the homeopathic hospital? Okay, so we have seen that. So they will provide the small like white color around the tablet, right? So that is a homeopathic. And fourth one is the Unani hospital. Unani hospital. So there they are giving the different kind of treatment for the Unani hospital. Okay, so I have seen that Unani hospital in Bangalore also somewhere else. I have seen. I forgot the place. So there the Unani hospital is there, and next one is the hospitals of other system. So hospitals of other system of medicine. System of medicine. So there other system of medicine, that means so different kind of hospital is there. Naturopathy, so they are using the natural things. Lot of other system. Have you heard about the acupuncture, the Chinese medicine? So they are using kind of medicine. So according to their system we can classify the hospital. So that is called the according to the system base. So what is the first one is allopathic hospital, and second one is Ayurvedic hospital, and third is homeopathic, and fourth is Unani, and fifth is the system of medicine, different others. So when you're writing you have to write like this. Don't do like this. According to you have to write the full form. Just for writing in the board I am writing like this. So according to the system, so you have to list out and you have to write about all the things within two sentences. That's enough. Okay, so this is about the classification of hospital according to the system. So in this classification of hospital, so we have seen the classification of hospital. So what are the things we have seen before? Classification of hospital. Okay, so we have seen classification of hospital. First classification of hospital, that is according to the length of stay of, okay, length of stay of patient. Stay of patient we have seen. So that we have to, that is long time and short time we have seen. And next one is the clinical basis. We have seen the clinical basis. We have seen the classification, general hospital, private hospital, all the things. And we have seen what are the things according to objectives. So we have seen according to the objectives of the hospital we have seen, and next one we have seen the size. Here it is the size. According to size we have seen the hospital, and fifth one we have seen the according to ownership. According to ownership, then according to management, then according to management, and according to system, and according to system. So these all are the types of hospital. These types of hospital will ask for the 5 marks. Very important questions you have to study thoroughly. Type of hospital and the classification, everything you have to study. Definitely will ask for the 5 marks in the Rajiv Gandhi University. And when you're writing the classification of hospital, as I said in the class also, so there we have to mention what is the definition of hospital. So definition of hospital, it's very important. So which is given by the WHO. So what is the definition of hospital? Hospital is the integral part of that definition. You have to write, and you have to write the classification of hospital. So if they are asking for the definition of hospital for the 1 mark, define the definition of hospital. You can write the definition of hospital. So this is about the classification of hospital. So thank you for listening, and if you have any doubt, please put on the comment box. I will be clarifying. If you want any other subject to take classes, that also you can write down the comment box. So thank you for listening. Please do share, subscribe and like, and please share to your friends about this class. I will be taking the continuous classes next video. Thank you for listening. Thank you.